my name is Alinta. So I'm the research and education coordinator at the Sickle Cell Society, and I'm leading a heritage project on the history of sickle cell in the UK. So I'm just going to share my presentation. So I hope you can see it. I'm not sure.
Yep, that's perfect.
Yeah, that's fine. So this is a project called Our Journey, Our Story. This is a project funding by the Heritage Lottery Fund, and it's aimed to trace the history of sickle cell in the UK from 1950s to nowadays. So first, I just want to introduce the Sickle Cell Society that you probably know. The Sickle Society is the national charity for sickle cell, and it was established in 1979. So it was formed by a group of patients, parents, and health professionals, and its mission is to enable and assist individuals with a sickle cell disorder to realize their full economic and social potential, to address lack of understanding and also inadequacy of treatment for sickle cell. What's the role of the Sickle Society? So it's to support individuals and their family, to provide recreation and leisure for individuals and their families, especially, for example, with the children's holidays, to support to release poverty for individuals and their family, and also advance public education and awareness. So the Sickle Society is helping with advice on managing sickle cell disorders. Also, like the helpline supports people with health, social and welfare issues such as health and education, benefits, entitlement and housing, employment support. We also signpost to other agencies and support groups all across the UK, and also practical and emotional support. So if we're talking a project, so as I've mentioned, the project was funded by the Heritage Lottery Fund, and the aim of the project was through oral histories to explore the history and memory of sickle cell disease in the UK since the Windrush arrival. So the Windrush arrival was used as a date. We didn't necessarily go far as 1950, but it was a date because this is where, also the demography of the UK changed. As we know, sickle cell anemia affects in the UK predominantly people of Black, African, and Caribbean heritage, and it's the UK fastest growing genetic condition. And the society thought that the project was crucial because although sickle cell disease has been recognized as a health condition for over a century, we know that this awareness still remain low, and people with sickle cell are still facing stigma. So what is the project going to look at? So the project is going to look at what the issue faced by people with sickle cell disease and the carriers of trait and their families, like how campaigning and lobbying has dramatically increased awareness and understanding of sickle cell, improved standards, and increased diagnosis. So it's like interviewing support groups, activists of people that increase awareness of sickle cell. We're looking at the role of the NHS, of patient support groups, and the Sickle Society, and also the works of individuals that have changed also, and that work really hard to raise greater awareness. So the outcomes, so Our Journey, Our Story is a project. What are the outcomes? So it's first, it's all linked together because it's starting from collecting oral history, so to interview people, and from those interviews we have sources, and one of one of the outcomes is to establish the first Sickle Cell Society archives at the Wellcome collection. So part of the archives is like the archive of the Sickle Society. The Sickle Society has a number of photograph papers that are in their office. So we've so far, like recently, just listed 22 boxes of archives that's going to be given to the sickle cell, to the Welcome collection, but also the oral histories that we've collected so far through the project. So we've done almost 32 interviews. So it's going to be donated to the Welcome collection. So it means that people, researchers, educators, anyone, general public will have access. In the limit of data protection, but they will have access to those archives in the near future. Though there was also, from those research, we've did an exhibition at the Black Cultural Archives. So because of COVID, the project has shifted. So we went from an online exhibition, and now the exhibition has opened in person. So the exhibition is available both online and in person at the on the Black Cultural Archive website, and it's going to be transferred to the Sickle Cell Society website. So it means that in any case, it's going to be available, permanently on the Sickle Cell Society website. Also, another important aspect was workshops for general public to engage with the general public and sickle cell patients throughout workshops, and the productions of a film. So it's quite a huge project, but it all stems from the oral histories that we've collected. So while we're talking about oral history and heritage, oral history, especially in history, in historiography, there was a development of oral history because oral history captures people's experience and opinions that shape the way they make sense of life. Oral history is a first-hand evidence of the past, and unless we collect and preserve people's memory, then they can be lost. And spoken accounts are really important because it fills the gaps in historical evidence and set your history at risk. It brings new perspectives and challenge our view of the past and give voice to those people that usually are excluded from historical records. So that's the importance of oral history, because most of the time we have books, we have written records, but they fail to give a grasp of what happened. And oral history is a key component of historical research. So that's why we need to capture those stories. So as I've mentioned, we did quite a few outreach. Again, because of COVID, things have shifted, because the idea was to work with young people and to also young people with sickle cell, and to work with the archive, with oral history, and to do workshop around that. But because of the pandemic, we didn't have access necessarily. We couldn't bring young people to the archive. So we still try to keep this idea of talking of oral history, of heritage, but we did a lot of online workshop. One of the first workshops we did, and was in collaboration with Tracy, my colleague Tracy, which was sickle cell disorders and the call for Black blood donors, where we looked at the history of donation, blood donation, or campaigning for blood donation. And we looked at back in the 80s to nowadays and how it's changed the strategy. And what was interesting is we brought, again, the oral history, we brought patients that notably Laura Burma, that with Professor Diamond Elizabeth, she designed this poster that you can see. She has sickle cell. She designed this poster, and we talked about the importance at that time and still today of calling for Black blood donors, and how things have changed, how what was the outcome, and what needs to be improved. So it was a reflection on history, but also recognizing the work of those individuals. We did another webinar at Imperial College, where we brought together history, science, and culture. And the idea was to have scientists but also we had the presence of Dr. Lola Oni, but also to have an Imperial staff, Imperial researcher, but also to talk to people, to bring their voice. I think that was the importance every time, is to bring the voice of patients and their experience, how they live with sickle cell and anemia. Another of those general public outreach was a conversation with Professor Dame Elizabeth Anyamu and Arike Oke, the managing director of the Black Cultural Archive. And following this conversation, we had the opportunity, myself and the project consultant, Dr. Grace Redhead, to talk with other patients that took part, that I interviewed, and which testimony are part of the exhibition, to talk about their experience of living with sickle cell, what it means, and also the three of them actually are creatives. We have Janika Lee, who's an author, writer. She writes children's book. Laura Brumer, who's, as I've said, she designed the poster, but she's an artist. And also Juno Koshi, that produced a photography series called Portrait of Pain. So one element we touched upon was art. Use of art to raise awareness, but also to express what they feel, how they're feeling with about sickle cell. Another element, and one of the important elements, was working with young people with sickle cell, because knowing history is really important. And also when you get a sense of your history, when you get a sense of where you come from, how people fought for raising greater awareness, you are empowered. And the idea is when they know, then they can also feel more confident to talk about their condition, but also to talk to other young to their peers, because it can be difficult when you are a young person, or especially teenagers. So we did three workshops, which of those kind, tell your stories. One for the children's holidays, one we've worked with Oscar Birmingham, and another one for Black History Month, where we brought young people with sickle cell. Laura Brumer, who's older. And the first part of the workshop, we did a quiz about the history of sickle cell. And then they used their creativity. So we play with words to tell what, it was a way to say which word they would use and how they were going to play around it artistically when they feel at their best and when they feel at their worst. And then there was an exchange between the young people and Laura Brumer. So they became their little historian, and they asked questions to Laurel about her life, her experience with living with sickle cell. And it was a really interesting exchange, because they did come up with a lot of questions about how it was back in the 80s. And there was some words of encouragement also from Laurel. So I'm not sure if it's gonna play, but I can play a clip. So if you can. I must have been in my 20s. So it's I've missed the. So I'll just go back. I think. So one element, so it's online, but one element on the workshop is that at some point they they asked some questions. So what message would you say to blood donors from blood donors from back then to this day? So, and those were questions that came up from the young people. They asked, what treatment, how did you feel? And one of the questions was like, do you think that the campaign worked, and what do you think we should do? So that was a really good exchange because they could relate. And that's something I've noticed with the workshop is like, as soon as she started to talk about her experience, that they talked about their experience and they were much more open about it. Another workshop that we did, and it was with Chocolate Films Productions. So they collaborate a lot with museums, galleries, and they've done projects even around HIV. So one of this workshop was a filmmaking masterclass, an online filmmaking masterclass, where we had two sets. We have like 11 to 14 and 15 to 16, and they create their own film using their mobile phone. But the whole workshop was actually how you create a film. And the idea for them was to respond to the theme of the exhibition and to create their own film about sickle cell. So they've produced some amazing work. And again, it gives them confidence. And one of the thing was like, it doesn't have to be sad. It doesn't have to be like, what do you want people? One of the questions we ask is like, what do you want people to know that you think they don't know about? What makes you, or, what not makes you special, but what do you want them to know that, or your friend doesn't know, or people don't know, sickle cell. And it was really interesting to see also the interaction around young people, because they were encouraging each other. So every time someone was saying something, they were like, yeah, it's great. So you could see that they were in a safe space to encourage each other and to use that. And it's also beyond that, it's like they can use it later on in life in their education. So that was an important element. And finally, the exhibition. So the exhibition was challenging because we're talking about working with archives, oral histories, and trying to capture the history of sickle cell. And so it's really, I'm just going to talk about the word capture because really we didn't talk about the whole history of sickle cell. That would be impossible. But what we tried to do is we did three, at the Black Cultural Archives, you have three space, which is Living with Sickle Cell, where you have a portrait of people with sickle cell, and you have a QR code, and you can listen to their testimony. Here you have Maya Phillips, which I think is is going to read a poem. She was part of the workshop, and we have her little film about living with sickle cell. Then we talked about challenging. So it was all the people, all the individual, the support groups that try to raise greater awareness. So Neville Clare, the Sickle Society, Professor Dami Elizabeth Ayambu, the Sickle Cell nurse, especially like Dr. Lola Oni. So all those individuals and all professors that talked about sickle cell and tried to raise greater awareness. And then the final part that I thought was really important, which was expressing, because I came across quite a few artists, so people with sickle cell that were using art as a way to express what they feel. And we had artists with sickle cell, but also the collaboration. So here is support with Laura Bruma, but also Larry Aponsa, who is a Ghanaian artist, and that we commissioned him to do some work for the exhibition. And he used the archive, what you see that I've sent him some images of the archive that we had at Sickle Society. He did some research and he created this portrait, You and I, which is our two people supporting each other, men and women, and quite striking, and it's at the end of the exhibition. So this is the exhibition, and the whole exhibition, because we can't touch anything, so we have QR codes. So one of the most important part of the exhibition is to listen to this testimony, because we put an archive and then there's a QR code with the archive. So where, for example, you have the archive, the case of Stephen Bogle in 1986, who died in custody, had sickle cell, and we can listen to Professor Dame Elizabeth Aneru talking about it. And so this is what we've done for the exhibition. We are hoping to finish the film also. Again, we have to change the way we did the film, but it was really and although we didn't use all the interviews that we had, because it's impossible, and because for curatorial purposes you can't use everything, I think all the research we've done, all the interview we've done, inspired us to do this work, because really what came across this whole process is like the patient voice, the importance of the patient voice, the patient knowing their and what's the implication of sickle cell for in their life. So not only physically, but mentally, and as I say, when they go from childhood to adulthood. And so I think that's really important, because I guess even for health professional, hematology specialists, it's important to listen to those voices. So this is part of the project. It's not totally finished, but that's why I wanted to present. So I'm just gonna stop the presentation now.